Hello everyone, Assalamu alaikum. My name is Noman Shafique. I am presenting a case study, a case of spontaneous abortion related to ovarian endometriosis in a golden retrieval dog. This case study is taken from Iran Journal of Veterinary Research. The history of case study was a 4-year-old golden retriever weighing 32 kg presented with abdominal enlargement at clinic. Pregnancy confirmed by ultrasonography at 30 to 35 days of gestation. Spontaneous abortion occurred 2 days after ultrasound examination. General condition was normal with no abdominal pain or sensitivity detected. Vaginal examination revealed serous discharge indicating fetal loss. On ultrasound examination, ultrasound revealed the absence of fetuses in both uterine horns. A hypoechoic cystic structure measuring 3.2 by 3 by 4 cm was detected behind the left kidney on ultrasound. Ovarian cyst was suspected based on ultrasonographic findings. Decision made to perform ovarian hysterectomy for diagnosis and treatment. On the right side, you can clearly see the cystic hypoechoic structure showing with thick and thin arrow on ultrasound. During surgery, the right ovary and uterine horns appeared normal. Cystic structure found in the left ovary consistent with ultrasound findings. Cyst was smooth, flat, thick-walled, and hemorrhagic in appearance. The entire reproductive tract, including both ovaries and uterus, was removed successfully. Specimen sent for histopathological examination following surgery. Here you can see the cyst on left ovary. Histopathological evaluation. Microscopically, the cyst measured 5 by 4 by 4 cm, smooth, thick-walled, and hemorrhagic. Microscopically, the ovarian stoma showed luteinizing cells and hemorrhagic cavity. Inner cyst wall lined by endometrial glands and stoma confirming endometriosis. Corona uteri and right ovary were histological normal without any lesions. Confirmed diagnosis: ovarian endometriosis associated with corpus luteum. Here on the right side on histopathological view, you can see the hemorrhagic foci and endometrial glands. So let's move towards pregnancy maintenance in bitches. How normally pregnancy maintains in bitches. CL is the main pregnancy maintenance structure in bitches because there is no placental takeover like other species. So CL maintenance means pregnancy maintenance. If there is any damage to CL, it means it will lead to termination of pregnancy. During early pregnancy, adults support Cl by attaching to its receptors on small uterine cells. During mid to late gestation, after 25 to 30 days of gestation, prolactin is the main leukotropic hormone because LH secretion starts to decline due to negative feedback of high progesterone on the hypothalamus. LH receptors also starts to decline and prolactin receptors also starts to develop on small and large uterine cells of Cl during mid to late gestation. Ovarian endometriosis and pregnancy. Ovarian endometriosis forms when endometrial tissue becomes implanted or grows abnormally within ovarian stroma. This ectopic endometrial tissue proliferates under estrogen influence, forming cystic hemorrhagic lesions. Accumulated blood and inflammatory reaction disturb ovarian structure and follicular development. Endometriosis reduces luteinization hormone receptor expression in ovarian follicles and corpus luteum. This leads to insufficient luteinization of corpus luteum and weak progesterone synthesis by the Cl. Low progesterone levels below 2 nanogram per ml for more than 24 to 48 hours results in spontaneous abortion. Progesterone deficiency compromises uterine support for embryo implantation and maintenance. Pathogenesis: Palliates human endometriosis cases causing recurrent pregnancy loss and infertility. Now, it's time to discuss the postoperative care. For postoperative care, we treated dog with amoxicillin and clavulanic acid for 5 days after surgery. Postoperative immunity ensured complete recovery and healing without any complications. Regular follow-up confirmed healthy status and no recurrence of reproductive issues. Effective postoperative care and hygiene prevented infection and supportive recovery. Suggestions: It is the first reported case of ovarian endometriosis causes abortion in a dog. Because ovarian endometriosis is very rare in dogs and it is a human-related issue. Ovarian endometriosis should be considered in unexplained abortion cases in bitches. Ultrasonographic examinations of ovaries is recommended for abortion investigations. Progesterone level measurement assists in evaluating luteal function during pregnancy. Histopathological confirmation required to distinguish from ovarian neoplasia. Timely diagnosis and surgical interventions are essential for successful management of this case. Thank you everyone for your precious time and active listening.